I'll post a question and you will all answer it in the chat box. And with your responses, will now know the potential domain that you belong to, and probably, um, what your interests are. So we want to know you through your response to this question. So here is the question. If you woke up tomorrow, let's say magically, you woke up tomorrow and you became a 1L superhero automatically, what would be your special power? Like, what special power will you choose? The ability to stop outbreaks outrightly even before they start or at the point of starting, or your ability to nullify diseases and just lay hands on someone and they're healed, or you would want the ability to put a dome over the forest and protect them so that nobody touches them without your permission, or if they have bad intentions to destroy the forest, then it will work naturally. Or you would want to just, create a market system that will make farmers really, really, that will make farmers make something decent from livestock production and crop production in general. And what would your superhero name be? So yeah, we're still getting the AIS stopping outbreaks. Okay, that's nice. Then what would your superhero name be? Can we have more responses in the chat box before we proceed? We do have some minutes for the introduction, so I'm not going to rush. So, oh wow, we have a lot of AI note takers here. Anyways, all right. So what else? Dr. AJ said stopping outbreak. Well, he didn't tell us. Oh, well, Dr. Rashida, to make farmers rich. I like that. Well, we are here to talk about rich, right? Talk about money. So, yes, making farmers rich is also a nice one. But what would your superhero name be? I think that needs a little bit of creativity. So, but then, please feel free. Or should I? Do you want me to go first on that? Okay. Well, stopping outbreaks. Oh, well, safe beans. Wow. Stopping outbreaks, thereby making farmers rich. Yes, at livestock farm level, excellent. Yeah, we are having a lot of stopping outbreaks. I think there is special interest in that. Well, I hope that does have quite a lot of socioeconomic impact. Of course, at the very least, we get better well-being, and so please keep them coming. We have up to 30 people on the call, subtracting the yeah, all right. Stopping diseases. Well, nobody's interested in wildlife or making, well, a few people making farmers rich. That is uh, not sufficient. We need to do more. But then, yeah, let me now put my own up. My name will be very long, but it was a senior colleague at my workplace that called me this name recently. So, um, all right, I would like to protect forests and wildlife because guess what? If we do that, we are doing a lot of good to humanity as a whole. Then there will be a reduction in the climate change crisis that we seem to be facing, and the diseases that you want to stop. When you protect the forest and wildlife, then like 70% of them are gone because, as we all know, it's 60% of zoonotic diseases, infectious zoonotic diseases, are from animals, right? And 70% out of the 60% are from wild animals. So if I protect the forest, protect wild animals, then I automatically stop the spillover of these diseases from the wild into. So I'm already stopping disease by protecting the forest. And uh, the side benefit of this now is that okay, we have better forests, better environment, and so I think protecting forests and wildlife have multiple benefits at this interface. But then it could be more or better. All right. So not to waste so much of time, you can still keep posting your responses if you have them. But yeah, thank you so much to those that have responded. To avoid waste of time, I will now stop sharing my screen and I will hand over to our speaker. But before then, you would like to know much about him, right? Because of course the call has been out for a while and you've seen his profile, you've seen everything, but then yeah, there's more to it. So I would like to give a brief narration of bio of our speaker today. So who is exactly is our speaker? His name is Dr. Shehu Shamsudeen, who I happen to have a long, excellent history with, but then I mean, of course, for the most things that we do, he gave birth to it because he was my mentor and I'm now the founder of Finance and Action Initiative. So he's potentially, we can call him our father. So his name is Dr. Shehu Shamsudeen. He's a vet and a social entrepreneur, and he has over 15 years of extensive experience advancing One Health and livestock entrepreneurship. So he has worked extensively in the space of livestock development, and he mostly uses innovative animal health business models, and not just the regular, okay, we go buy and sell. Animal health is something that has a One Health implication. So he uses innovative approaches to bring together all of these benefits in the design of all the solutions that he puts up. He co-founded Amvet Consults, and for those of us in Africa, we must have heard about Amvet Consults. And Amvet is simply a rapidly growing company that has supported thousands of smallholder farmers in Nigeria with quality livestock inputs and advisory services, including landmark vaccination programs that has reached over 45,000 rural farmers in the country. Now, he pioneered a lot of market-driven, community-based animal health programs, and most prominently, the Last Mile Community Animal Health Workers Project, which has more than 200 community animal health workers currently serving across the country. And he once met with King Charles, the Prince of Wales, back in 2018. I wish I could display the picture here. Well, that's a lifetime privilege that most of us really pray for. And he is currently a consultant at FAO, and he's supporting animal health business program development and for veterinary professionals, especially those of that are entrepreneurial and want to, embrace the concept of, One Health and entrepreneurship in their business models. And that is currently happening in Nigeria, South Africa, and Uganda. So without saying so much more, I would like to welcome Dr. Shehu Shamsudeen to take the floor. Please let me know if you'd like me to share the screen or you will be able to share from your end.
Yeah, good afternoon, good evening, wherever you're joining from. Thanks very much, Dauda, for the introduction. Can you see my slide now?
Yes. Yes, we can see, but it's not yet in slideshow. So.
Oh, it's on slideshow here.
Yeah, it's slideshow now. We can see it now.
Okay, yeah. So good afternoon, everyone, and I'm glad to be joining this conversation. Don't mind that some of his introduction and when he said I am like a father also, so I felt, oh, am I that old now?
No, not that old.
Yeah, well, I understand. Yeah. So good afternoon. I'm really, really excited to join this conversation. It's not a lecture, and that's why it's properly placed in One Health scenarios. It's a conversation around something that really matters to us in Africa, and something I hold very dearly, close to my heart. As a young passing, I mean, in final year in the university, I became obsessed, if you like the word, with One Health and really pushed awareness, those regular One Health stuffs and so on. And also co-authored a paper on One Health back then, about 15 years ago. But as I continued to, ventured into business, started managing people, supply chain, veterinary enterprises, I was able to even relate more with the One Health, from the concept to now practical realities of how people, animal health, and environment are so interconnected beyond, our imagination. But again, I began to ask myself, so why are we not using One Health, entrepreneurship? Because as an entrepreneur, entrepreneurship for me, it's a way of solving problems. And One Health, there's a lot of challenge that One Health approach tend to solve. But the question I kept asking myself is, why are we not using entrepreneurship? Why are we using business approaches to solve One Health challenges, especially in Africa, where we have limited resources, we are burdened with high, level or burden of zoonoses, AMR is on the rise, our unsafe food systems, and, to nail it, all, you have a lot of climate shocks, rising temperature, flooding, all of these climate shocks are significantly changing and affecting people and livelihood in Africa. So One Health, it's good in itself. In the concept itself, it's a very good concept. But it's often donor-driven and fragmented. From what we have seen in the last 20 years, when you think about One Health, you see projects or short-term projects, interventions, trying to solve some challenges using the approach, a collaborative approach. But again, the question is, beyond this donor-funded project, policies, training, and so on, how do we translate this into sustainable businesses that will be owned by local actors, where we begin to see ourselves as actors in the One Health space and not just beneficiaries? I'm sure you understand what I mean. So entrepreneurship, why entrepreneurship is good for, is a good candidate for solving this kind of, complex, wicked problems. One Health challenges are wicked problems. They're not linear. They don't have one fix. They require collaboration, require, system thinking and so on. So entrepreneurship starts with the challenge. And entrepreneurs see challenges as, potential, when they see challenges, they see solutions, they think solutions. And then solution, build the solution, and then it leads to impact, whether it's business impact, whether it's social impact, economic impact. I would like to ask, before we go really into the discussion, so when you think about One Health, when you hear the word One Health, what readily comes to your mind? When you think about One Health, just type in the chat box. There I said that this is going to be interactive. What readily comes to mind when you think about One Health?
When you hear One Health, what do you think? Just type it in the
what
chat.
do you think?
Or if you want to speak, we can allow one person. So I will activate the mic.
Okay. Yeah. So maybe just one person, but other people can just one word. And okay, so what I want is one word. So just one word. If you hear One Health, what comes to your mind in one word? Just one word. Save time.
Wow, multi-sectoral collaboration, excellent. Collaboration.
One word. Collaboration, great.
Collaboration again.
Great. Balance, good.
Balance.
Zoonosis, wow. Okay. interconnectedness, create collaboration. Seems collaboration is winning, the game multidisciplinary.
Yeah.
Great. Okay.
Interconnectedness. Yeah.
Interconnectedness.
Fair enough.
Let's take 3 more.
Yeah, we
Maybe
can go
something.
multidisciplinary collaboration again. We have plenty of them. Yeah, collaboration seems to have won this one. Second is multidisciplinary.
Okay, great. Okay, so what is missing in the current drive for One Health? What are the issues with the current approach to One Health? Mostly donor funded. In all honesty, you will agree with me that most One Health initiatives are donor funded, grant based. And after 2-3 years or 1 year, sometimes after funding stops, you struggle to see anything on the ground, whether in terms of impact or solutions, infrastructures, and so on. And for Africa, I think this is like it's even more. This conversation is more timely with the current funding cuts in the donor development space. We saw how you said funding stop. I mean, has really affected a lot of people, a lot of communities where surveillance is being funded, or One Health initiatives, trainings, and so on. Not to talk about the millions of jobs that have been lost. So I think this is time for Africa to reflect. How do we come out much more broader and bigger and be able to solve our problems ourselves and in a more sustainable manner rather than depending on donor-funded projects? And for me, I see an Africa where young people are not beneficiaries; they are actors. They are architects in in building their own future, the future of the health system in Africa, using innovative business models that are business based, where everybody has incentive from collaborating, because we talk so much about collaboration, but what are the incentives for collaboration? How do we turn this collaboration concept into packages that have win-win for everybody who wants to collaborate? Top-down design, most of approaches, and this is not just about One Health, to be frank, most of these projects are designed by experts at the top and not necessarily knowing the realities, the local realities and the challenges in the communities. And therefore, after the project or after first few months, you don't get people to local people to own the initiatives to be able to continue with it. And that's where you see a lot of abandoned projects or abandoned infrastructure, be it dam or laboratory or hospitals in communities or watering points for livestock. There are hundreds and thousands of this kind of abandoned initiatives because of lack of local ownership as a result of the design or the approach. Policy and training focus. Most One Health initiatives are either trying to drive policy or or processes or laws or regulations, and or mostly about training. And while these are good, these are fundamentals, these are basics for you to be able to change any system, but there's less focus on implementation models. So how do you have the right policy environment, you have the people already trained, how do you move from policy and capacity building to implementation? What are the models that are practicable, adaptable to our context that people can see and feel on the ground? Those are missing. Successes are mostly measured by activities, so number of people trained, number of disease outbreaks or responses, number of burden of disease outbreaks and so on. But rarely would you find business metrics, like how many people, how many entrepreneurs or how many jobs were created, how many new businesses were created as a result of this intervention. So these are some of the issues. And so that brings me to One Health Entrepreneurship, which is an idea. And I'll be bold to humbly also say that this is a new approach that, and a definition that we were able to document and come up with in 2024, and we defined One Health Entrepreneurship. So I think it's a meeting ground for the regular One Health and also entrepreneurship. So how entrepreneurship and the very nice collaborative mindset of One Health, how do they come together to help even solve these issues of humans, animal health, and environmental health in a much more bigger and sustainable way. So it's an approach that applies sustainable business solutions to interconnected health challenges affecting people, animals, plants, and ecosystem. So for One Health Entrepreneurship, we see that it has to be cross-sector, or it's mostly cross-sector. So there's collaboration between the health, human health, or animal health, and environmental health, or even with partners within the same sector. Market aware, it's an approach that thinks first about the market. So, this is a challenge. People are having, people in these communities don't have access to water, and that can be a risk in terms of all animals and humans in this community share the same watering point. This is a challenge. There's a risk here. How do we solve this problem? So the regular way would be, create borehole, donate boreholes, or watering system, and but the entrepreneurial way is to say, okay, so can we sit with these people? This is a problem that we think they have. Can we bring in the people and confirm from them if this is actually a problem? Are there other things that we don't know about these communities, as we're going to see with one case study? So, but most importantly, so what is the market in this? So if we create a borehole or a borehole or filter, water system for these communities, how is it going to be sustained? Who owns it? Who pays for it? Even let's say we pay initially, how do we continue to sustain the maintenance? Can we get people to come together as a group and invest in this and maintain it and charge people for use, pay per use, or any other model? So it has to be market aware. It's inclusive. So in One Health, because entrepreneurship is very customer focused, so we see communities as as customers and not beneficiaries. And that's, for me, it's we dignifying the actors. It's rather than seeing them as people who we just want to help. No, these are people who are willing, to buy into a solution because they have seen the benefit in it, and they are willing to even pay, for those kind of solutions, depending on the context. So, which means that they have to be involved. So it's inclusive, the youth, women, elderly, people with disabilities, the communities, the people in the ecosystem, the customers, the people who are going to use this solution or innovation. Actually, we need to involve them right from the beginning, and that's where entrepreneurship actually wins. In sustainable businesses, you really need to focus on what the customer wants and not what you think they want, or not what you want to sell to them. Locally owned and scalable. So we see, using entrepreneurship mindset allows solutions to be locally owned, and they become scalable. So from one, let's say, slaughter slab to maybe 10 or 15, from one maybe watering point to 15 to 20, because the model is scalable, it's sustainable, and people can replicate it. So a good thing, very interesting thing about similarities between One Health approach and what we're talking about, which is One Health Entrepreneurship, is both approaches value cross-sector collaboration. So while entrepreneurship values collaboration, because we believe in enterprise development, that no single person or sector or company or enterprise has all the resources or the knowledge and the expertise to solve a particular problem. So the same thing with One Health. One Health is built on, on the value of collaboration, of cross, fertilization of ideas, of coming together. Co-investment and shared infrastructures. Yeah. So entrepreneurship believes that instead of we can save costs if we collaborate. For example, if imagine a cold chain facility owned by a public health organization in a community. Now, if I'm a vet and I also want to, I want to deliver vaccines to livestock in those communities, and there's a huge facility that probably is underutilized. Instead of, investing and creating a new solar, powered, facility, why would I not explore the possibility of using the same code, facilities that has been used for human vaccines in the same, condition, as far as some measures how we put in place. So we believe so much in co-investment and shared infrastructure, trust, innovation, and system efficiency. One Health has reached the level it is right now today because there's a lot of trust building that has happened between even human health, animal health, and environmental health professionals. Before now, everybody was working in silos. People don't even sit on the same table to discuss. Now we're seeing a lot of, thanks to WOA, FAO, WHO, a lot of, meetings and workshops and joint trainings and so on. So there's trust, there's innovation, and then there's system efficiency. We believe, both approaches believe that in collaboration, you are able to achieve more with less in terms of resources. So how can entrepreneurship strengthen One Health? In Africa, these are mostly some of the thoughts that probably have, mentioned somewhere else, but I think when we look at the entrepreneurship approach to One Health, we see sustainability. We see the ability of these initiatives to self-sustain themselves. Beyond initial funding, a system where the infrastructures, the innovations, and all of those, outcomes that have been created can continue to exist and probably also even grow beyond where they were before the intervention. So revenue-based continuity, entrepreneurship, when we look at One Health initiatives or, problems or challenges in terms of, so who is paying for what? How do we get people to pay for some of these services and products? That it means that we can continue to have adoption it means that those solutions or products that have been created would continuously have people buying and paying for them, which means adoption will increase. So the whole idea of why are we talking about One Health, we want to change the way people do things. So if there's a product that is affordable, available, and has been created using the One Health lens, the next thing would now be, how do we get people to pay and continue to pay for it so that this product continues to exist and continue to solve the problems that we are trying to solve? So local innovation, entrepreneurship, brings a lot of innovation because you're trying to create products and services that will appeal to the customer, that the customers are willing to pay for. It means that you have to listen to them. You have to bring new things that will make life easy for them, that will make adoption easy for them, and that will be adaptive. So entrepreneurship allows us to be adaptive because sometimes you start up with a product that you think is good or a service, but from the feedback you get from the customers or from the end users, you need to continue to adapt until it fits into, what they are willing to pay or pay for. So that's the local innovation. Private sector energy. Private sector is driven primarily by profit, but also there's a lot of social enterprises that are both profit and and impact driven. So because of the drive for profitability, the private sector is likely more efficient in terms of responding to needs, in terms of investing. When you know that if I invest $1, I'm going to get $1.2 in return, or I'm going to get $0.2 in return, there's likelihood for you to continue to invest in those solutions. And of course, there's nothing wrong in investing in solving problems that people are facing, for you to be able to make money in it, as long as it is legal and the approach and it's ethical. Just that we have like people paying for a lot of things, from phones, smartphones to TVs to so why can't One Health also take this approach? So inclusive impact, entrepreneurship, just like I said, focuses a lot on listening, on involving the customers, the end users, in designing product and services, in improving product and services. So therefore, you need to look at the demographics. Africa is largely a youthful population, with a lot of also populations, women. So using, youth and women-led delivery models is one of the things, one of the ways that to ensure inclusive impact, and entrepreneurship has tools and framework for that. So maybe now we look at a case study, which the transforming poultry processing for One Health. So because unless we start looking at One Health from this kind of practical lens, there's a high tendency for us to think that it just stops at the concept and abstract. And every day in our communities, there are One Health challenges, there are One Health solutions already in place. There are One Health actors, but we don't see them as such, or we don't see these problems as One Health problems, or we don't see the solutions already in place as One Health solutions. So we tend to think of One Health as one abstract thing. But my job today is get us to look inward and think and apply this, One Health ideas and concepts in viewing the challenges in our communities. And so doing, our eyes will continue to open to the opportunities, business opportunities in those challenges, and then we become One Health entrepreneurs. So, so what's the challenge in this case? The traditional poultry slaughter practices in this community lack hygiene. It's risking public health through foodborne diseases, it's impacting animal welfare, because in most of this kind of setup, you still have live animals or live birds somewhere around where they just pick the live birds, slaughter them, and the way they keep them, it's actually, animal welfare positive. So, and also causing environmental pollution. You can see how the polluted environment is. So don't be surprised if people here come down with some foodborne zoonoses or some other environmentally acquired zoonoses. This is a challenge for you as an entrepreneur, as a One Health enthusiast or One Health advocate. This is a practical challenge for you to solve in your community. Let's see how this is, being solved. There's need for validation, a need validation. This is what you have seen. But you want to talk to farmers, you want to talk to the people working in the slaughter slab, you want to talk to health authorities in the communities about their concerns and their ideas and what they think, how they think we can solve this problem. So that's how entrepreneurs work. They don't come with the mindset of I know it or no, they listen, they go into the market, they listen to the voices of the market, what the market is saying, what the actors are saying, and together build solutions and then invest in such solutions. So the idea from this need validation, some ideas came around, okay, let's design a modular hygienic poultry slaughter slab so that we can enhance food safety and minimize environmental waste, and something that has to be affordable. So a market research was conducted and local survey revealed that, yeah, there's a strong demand for improved slaughter facilities. The community, the people there are also concerned about their health, about consumer safety. The public health authorities, they are worried about incidences of diseases and the risk. The environmental officers and the government environmental are also concerned about the environmental pollution. So, but also, most importantly, market research revealed that people are likely to be willing to pay if we design a clean, easy to use slaughter slab in an hygienic way. So what is the business model? So for any idea that you have and you are making market research, you need to ask yourself, so how do we make money? How do we generate revenue from solving this problem? And which is what is largely missing in most One Health conversation. So here, idea of using a pay-per-use model for farmers. So you can bring your poultry here, per animal slaughtered or poultry slaughtered, you're going to pay. And there's a partnership, and that's where the One Health collaboration, the local government health authorities, environmental authorities, and the veterinary authorities are in support. So there's a kind of PPP, public-private partnership, which is also a form of collaboration, which One Health seek to actually promote. So prototype here is developing a small. So when you solve a challenge from business perspective, you don't solve all the problem at once. You don't design the solution completely. You need to just do something that's very minimal. So what is the product? Can we test something small in a small scale and learn from it and see whether it will be efficient and see whether people will be willing to pay for it, and then continue to adjust based on feedback. And that was what was done. So from prototype to testing, then you expand. So I've done this in one community, it's working, people are paying, we have improved, the design and everything, and even the amount of money people pay. Then you can easily then replicate this model in other places. So it may be a technology, not necessarily like, a hardware product like we're seeing here. Technology, it follows the same principle. You prototype, you test, and then you expand, you scale. So what's the impact of this? One health benefit is improved food safety, reduction in zoonotic disease, and lower environmental contamination. So you have helped the community solve these problems as a One Health advocate, but you're also making revenue, you're making some income, you're creating jobs for yourself or some other people, and you're making this facility to be sustainable rather than relying, for example, on government for funding, which never comes or is never enough. So you can scale this across region and, continue to replicate it. There are other use cases, some other examples of, there are millions of ideas that you can get from just going into your communities on the market and listening and seeing what problems people are facing and using your One Health lens to see how is this connected to human health, environmental health, or your animal health, or all of this. So from mobile agro-vet units where you have animal health, imagine a vet with a mobile vet unit working with a public health or a human health nurse somewhere, and they generally provide education in communities using a mobile app, but also, using mobile units. There's one, what I saw is it Somaliland, what you call One Health units. Is the concept, I think, is the project that is being funded, I think, by, I can't remember the donor now. They're mobile One Health units where you have human health, animal health, environmental health practitioners operating local stations, and they provide all these services to people. But I'm not sure whether people are paying for such. So imagine that kind of collaboration. Imagine also solar vaccine hubs, having a PPP with a local health facility in your community, and you keep your vaccines in those locations, and you are able to save costs, you are able to save energy, and you are bringing vaccines closer to people, both human and animal health vaccines. So think about business of solar, vaccine hub, or where you have the solar hub, you're investing in, but people who are nurses or public health practitioners or pharmacists, local pharmacists, bring those vaccines to your store for storage and they pay you. Also, you have another facility in the same location or in the same room, probably, where veterinarians or veterinary paraprofessionals bring vaccines for storage and they pay for it. For me, that's One Health, in action, because you're improving human health, animal health, but you're doing it and with business sense. NutriCycle, black soldier, fly farming, environmental intervention, just like recycling, having innovation like black soldier, fly farming, from food waste, from households, for example, or even animal waste, and you use that to produce feed for animals. And you are also using, you also, by doing, this kind of, recycling system, you are improving soil quality. So that's also an innovation that you can think about. Watershed and health and wellness. Portable water purifiers in communities can help reduce incidence of diarrheal diseases that are either due to, zoonosis pathogens or just regular non-zoonotic pathogens, for example. So just intervening in a watering system in a community where, for example, human and animals share the same water point, share diseases, and you come to the community, you intervene, you provide a clean water source and people pay for it, you have solved the One Health problem. So let's not think about One Health as something abstract and not achievable. There are things that we're already doing, but we're not probably applying a business orientation to it, and that's why it's not sustainable. So as I round up, I want to ask, what do you think what needs to happen for us to shift from One Health ideas to action? And Dr. Dauda rightfully named his NGO in One Health in Action, because this has always been our conversation behind the scene, like how do we take these things into action rather than, theory. So we need to train practitioners in entrepreneurship. We already have a lot of trainings for One Health. From public health, zoonosis control, to One Health principles. How do we include entrepreneurship training for sustainability of this One Health initiatives? So here, support youth-led One Health innovation. Like you have technology innovation challenges, finance, fintech challenges. We want to start investing and seeing people and businesses investing in One Health innovation, because from here you can incubate a lot of ideas. So investors can call up for a challenge. So who has a solution for a particular One Health challenge, and they aggregate these ideas and develop them and invest in them and scale them up. So I see in the future, venture capitalists and even social impact investors investing in One Health entrepreneurs, either buying part of the business or buying all of the business and scaling these businesses into real solutions. Mobilize social and blended finance, just like I've said, financing models. Like for me, I see One Health entrepreneurs as social entrepreneurs. So there are a lot of social impact investment funds that we can leverage. So as we advocate for One Health in countries and policies, we need to also include advocacy for financing One Health businesses or One Health entrepreneurship. I think this is very, important for advocacy. And we have to track impact through sustainability metrics. So we're not tracking impact based on just number of animals vaccinated, number of people vaccinated, and all sorts of things. We want to see what are the business metrics, like how many businesses have been created, how much revenue are these businesses earning, how much are they contributing to GDP, how much tax are they paying, and so on. So for us to build this, everybody has a role to play. The government would give enabling environment for public-private partnerships, which is one very key, approach to collaborations with the government. Private sector and government, they should remove barriers to business. A lot of young people want to start businesses, whether One Health or not One Health related, but the barriers to entry, financing, the infrastructure and so on are not there. And also some tax and regulations hindering young people from really venturing into businesses. Academia, we said we need to co-create courses. I'm happy Dr. Abdurrahman is there, Dr. Zainab Dambazo, some other people from academia, and this is a challenge to you, my teachers. We need to co-create courses and case studies showing that it is possible. There are already some successful One Health businesses in Africa that we can learn from and use it to train future One Health practitioners. The private sector needs to invest and co-design this delivery. I want to start seeing private sector ably represented in One Health conversation. That's almost missing from what I have seen across Africa. Like when we think about One Health, we think about, oh, this is public health, oh, this is government driven. So we miss the opportunity to get ideas, innovative ideas, and and contribution from the private sector. Communities need to co-own the model. The communities to start seeing themselves as actors, as owners, as entrepreneurs, and not beneficiaries, not people who are trying to help all the time. So I see One Health entrepreneurship as a bridge between science and sustainability. And I invite you all to think about this. And we say that we can't solve 21st century health problems with 20th century delivery models. So we think that One Health One Health entrepreneurship is an opportunity to lead, to get Africa in the limelight and to lead, solving our own problem by ourselves using our own resources. So I would stop here for sake of time, but I'll be very happy to take questions and comments on this this topic that I'm really, really passionate about. And I invite you to join this movement. It's a movement that is going to change, the narrative for good, I hope, and make Africa even more prosperous. Thank you.
Thank you very much. I wish it was a physical meeting and you can hear how loud the applause will be. People are already asking for the slide. Thank you very much. That was excellent. Power packed, just 10 slides, but look at the message. Very strong and a lot of examples. Please don't steal any of those models. I'm already eyeing them. So allow us to use those ones. Think about your own solutions and then try to make something from them. Thank you very much. All right. So I know there's a lot we want to say, but we are running out of time. So we do have a breakout room. We'll give you more time or more opportunity to actually discuss. It's going to take 15, 20 minutes. Then when we come back, then we can undo all the questions and inputs from the breakout room all together at once. So now I will share everyone into different breakout rooms. I will share my screen now so you see the questions that you're supposed to go into your breakout room and answer. However, I will be in each breakout room to, share this the same question with them so that we don't nobody misses out. So those that will go to the first breakout room, like what do you think is the biggest one of problem in Africa right now? Is it antimicrobial resistance? Is it sustainable food systems? Is it because when you look at it, antimicrobial resistance, it touches on a lot of things. It has financial side, but food system, if you can solve antimicrobial resistance, and then there will be problem elsewhere. So she will now focus on the actual, which is people humans, animals, we need food, and that's why food is very important generally. So she will be looking in that direction, or she will focus more on disease, or clean water, sanitation, and hygiene. What do you think on the continent of Africa is the biggest challenge right now? So that all of us will now design again, as you said, an entrepreneurial solution to that, and it will be market driven. Now, the people in breakout room 2, what are the biggest challenges that entrepreneurs face when innovating? So maybe you have on your own sat down to even also think about this kind of solutions. What are the challenges you face, or what do you think these people will face when they try to create these solutions? And lastly, what partnerships do you think are most important? Do you think, because now, like you rightly said, on the registration form here in the meeting now, we have more public sector people and academia people than private sector people. But how do you think we can change this narrative, and what are the partnerships that I think are very important for entrepreneurs to actually develop these solutions? Now, I will stop here. Everybody will go into their breakout room. I will send us back, but then we are not going to waste time in the breakout room. We will come back here. And please, very important, any breakout room, please, the first thing you should do is to select somebody that will represent you when we come back to plenary to come and discuss about what you have discussed and any questions that might have come up. I will be everywhere to, please feel free. This is a community, and then you don't be shy. Like, this is not a 1 + 1 = 2 kind of setting. This is advanced and entrepreneur setting. So there's no foolish question. There's no foolish answer. There's no incorrect response. There is no correct response. Everything is correct because we're trying to do what's to be innovative, to answer new questions in very interesting ways. All right, so we are going in 3, 2, 1. Oh. So once you will see on your screen the room that you have been posted to, and then just click on join and you will be in. And I will come into your room to send you to your question. Okay, so if you are yet to join, if you're having problem joining, please just let me know and I can push you to a group, but I can still see quite a number of people here. Just join your breakout room and make sure it's as interactive as possible. We do have up to 15 minutes in that, and we can come back to plenary to discuss everything that must have happened in the breakout rooms. Okay, so if you need any assistance joining the rooms, just let me know. Or if you want to be in a different room, I can just send you to that room. Okay. Another announcement, we will be receiving our certificate shortly after the session. Please, if you're like, for example, Dollar King, we cannot issue a certificate to Dollar King. ED, we cannot issue a certificate user. So please use your full name so that we can use that for your certificate. We want to make it as snappy as possible, so we will not be tracing incorrect names or wrong names for now. But please, if you happen to do not have your correct name as your username, please change it so that your certificate will come ASAP. All right.
No, Dr. Dauda.
Yes, sir.
I was in room 3, and I think we don't have the questions. We don't know what the questions. Nobody actually was able to tell. Maybe
Okay, let me start.
Drop
I
them.
will. Yes, I will join room 3 now. I'm waiting for people to join their.
Yeah, people. If people don't join this, you can just leave this plenary as one group and let them talk here if they don't join.
Yes, I've sent the question to them now. They have it now. Let me do that for the other rooms. All right, let's give a few more seconds for everybody to be back. And thank you very much for going into the breakout sections. I was in all of the breakout sessions, the breakout rooms, and I had extremely interesting discussions going on there, which is good. It means that we are inducing action already, which is an excellent thing, not just for us, but for the communities that we serve as a whole. I feel very privileged to have had this particular audience today because everybody seems to be in line with what we are discussing. What we can promise from our end at One Interaction Initiative is that it will not stop here. If we need to do some other more detailed sessions, which will be in form of workshop on how to, implement entrepreneurship in One Health, we'll definitely do that. Thank you very much. It's really appreciated the time, the efforts that we put into these breakout rooms. That said, now we want someone to represent Group 1 to briefly, in 2 or 3 minutes, share with us what are the critical points that were raised in the breakout room. The question was, what if you had to solve one very big problem in Africa right now that you think we should pay attention to? Which one will it be? So Group 1, please, your representative can unmute themselves and speak. I have activated the mute button for everybody in the room now. So everybody is free to unmute themselves and speak, not just the host and the co-host. All right. So who is representing group 1? And there is no escape. It's just 3 groups. So if you don't talk now, you will talk later. You can't just miss it. All right. Please go ahead.
Dr. Muhammad, I think, will present us.
All right.
You see, Claude?
Well, my background is noisy. If he suggests I should represent us, I'm going to do that. Why I was shying away is because of my background. But if you can hear me well.
Yeah, we can hear you clearly. There's no problem
yes,
right now.
We discussed 2 aspects and narrowed it to AMR. For the zoonotic problems, we possibly at the end, I will just give some highlights. But for the AMR, basically, we have one thing as a problem. What is that thing? Diagnosis and prescribing the right antibiotic for a particular treatment. Unfortunately, if we don't have a proper diagnosis, we will end up even compounding the situation of AMR. Because I don't know where you guys are practicing, but where I practice, I don't know the closest laboratory that will give me results in 12 hours. And if that one cannot work, that tentative diagnosis go with tentative prescription. And tentative prescription will compound situation of AMR. That's on the part of the professionals. Going back to farmers and possibly individuals that just walk into any veterinary shop or any pharmacy, give me tetracycline, give me Oxytet, and you just go and pump or you swallow the capsules. That's another issue that we have to be serious on. The pharmacies, the veterinary shops must rely on prescription. Otherwise, the way and manner we are going in this country or in Africa, I don't think we are going to see a headway when it comes to AMR fight. Because everybody is contributing to compounding the situation. Laboratories are not giving results, or they are not there to give results. If we want to take care of that, maybe site test kits that will help. Site test kit that will help us in prescription and possibly do the right thing. For those that are going to farm vet shops, they should present the prescription signed by the vet or whoever is in charge. That's all. And awareness. Again, what I said is we have to go as low as possible. We have to go the olden way of doing awareness. We have cinema box in the past that visit villages in the evening when everybody must have finished what he's doing and show them what to do to improve their lives. Until we resort to that, we cannot get it. So I think that's the summary of what I have.
Thank you very much. That was excellent. I think I picked some Dr. Aliu, thank you very much for putting that in the chat box. So that is the summary that I actually picked from this presentation. I think the business side of this will now be how to fix laboratory testing in between patients and the pharmacist and drug dispensing, because right now there's no gap. Everybody just goes to the pharmacy. Even those practicing in animal health, yeah, we just like most especially farmers and occasionally animal professionals, they just go to where they get these antibiotics and everything and feed it into animals for all sorts of reasons. So I think we need that barrier between, the patients and the clients and the farmers and pharmaceuticals, and that has to be the laboratory, so that there's a gateway that feeds back on the right type of antibiotics to use and for what infection. So thank you very much. That is an excellent one. I'm seeing a lot of business models coming out. Is this an incubator session or or a webinar? Let's see. Dr. Shehu, please go ahead.
Yeah, this is really interesting. Thank you, Dr. Kojafa, our senior colleague. I just want to emphasize that you see that we're beginning to now think and act like entrepreneurs. Like, without apologies, there are business opportunities in this challenge. So if you, for example, invest in distribution test kits, you are not only doing that because you want to make money, but you are practicing One Health. Like you're reducing the chances of incidence of antimicrobial resistance in humans and animals. And by so doing, you're getting a reward which is in form of income, but you are also helping public health. So I like to commend this thinking. There are two businesses I'm seeing there. I have seen laboratories. You don't have to be fully fledged laboratories, but I'm also seeing rapid test kits businesses, pharma side test kits or pharmacy side test kits. So thank you.
Yes, what we can do on this one, on our team, is we can try to look for innovations like that and see if it's only the business side. Then we can ask Dr. Shehu for money to import this and then introduce it to farmers. So we will look out for. Yeah. So because what I understand from colleagues abroad is there are solutions like this that are currently being developed. Some are already at the testing phase and so on and so forth. So we'll look if there are ones that we can import already, then we can look out for collaborations within this group and see how we can bring it in and try to expand the reach. Thank you very much. So group 2, go ahead. Dr. Francis, please.
Group 2, we were able to identify several challenges that may impede on the implementation of One Health entrepreneurship in Africa. One of the challenges identified is poor or lack of political willingness. And second is legislation, because you want to do anything, you need law, strong legislation, then identifying the problem, and then community buy-in and ownership, difficult in adapting new innovation in Africa, identifying stakeholders who will be willing to assist in implementing the task, professional rivalry. Everybody want to work solo. People don't want collaboration. And that is a problem. Building trust and loyalty, poor implementation of policies, government support, and then cultural barrier. These are the challenges that were identified in group 2. Thank you.
Excellent. Thank you very much. These are very correct, because for the business environment to really be conducive for entrepreneurs, we need this willingness from the political end. And Dr. Abdurrahman in Group 2 also mentioned something that is very critical, which is identifying what exactly is a public health problem and knowing the components of this problem, knowing because if you understand the problem very well, to solve it then becomes like a lesser half of the issue itself. So, and it's also one of the challenges that I think we're facing in entrepreneurship in Africa, especially when we want to introduce into public health and One Health. I mean, sometimes some of their regular situations that we think are problems, because in the development space, these things have been identified as problems, which of course they are just normal happenings and they have cultural sides to them. But then the big question for us now is like, how do we identify, okay, this is a proper public health problem that has implications on human, animal, and environmental health? So that is another excellent one. Thank you very much. And I'm happy to inform you the meeting is being recorded. We'll also write a draft report, and all of this package will come with your certificate when we send them. Thank you. All right, group 3, then I will announce on what's next from us.
I think group 3 was opportunity to be there, and Zinat, were you able to take notes? Or I learned that you said you'll be driving us, so were you able to take notes? Or so basically in group 3 we were looking for the question. We didn't see it, so we decided to be entrepreneurial.
Sorry about that.
And we created our own questions and solved the questions ourselves. So as entrepreneurs, you have to be adaptive and be very proactive. And I think that's also one lesson. So we're still able to make use of the time to discuss. Many people in the group said they were here to learn, to listen. They're mostly thinking about the ideas and so on. But one idea that really came up was Zina shared. She's an environmental health practitioner, and she's trying to solve the problem of AMR in some communities. And so far, so good. She has gotten very good buy-in from the communities in terms of them, but she would like to explore more, maybe session or support mentoring for her to be able to really turn that into idea. But so far so good. At least is engaging the community. They like the idea. They see it as a problem. So I think there's the odds of success is already very high for her if only she's able to get the other parts together and come up with. She's trying to come up with an idea of a water recycling system that would enable the water not to waste, but also you can use water from the sewage to water some non-edible plants in the communities instead of wasting. And then, so things around water solution. Then Dave, I think, also shared about some of the challenges facing regarding business right now. It's acceptability of the product. The place where the market is, people are finding it difficult to accept his own product. And also financing. He thinks about also how to finance the business as a challenge. So these are day-to-day challenges entrepreneurs face. Over.
Thank you very much. And those are really realistic. Yeah, Zenatudin was on our working group for climate action before now. So I know she's involved a lot when it comes to environmental health stuff. That's really excellent. And yeah, you can see from here, wow. So we just got a recommendation that I'm going to screenshot. I attended lots of webinars where involvement, sharing, and breakout session of this webinar was really great. All right, that means you're attending our webinar for the first time. This is our own tradition. We try to carry everybody along, and it's usually interactive and it's productive. So when we send reports, you see like key actions that you can take moving forward on your own. All right, so we are about 90 minutes that we intended to spend. But then before then, I will like to just announce what are the things you should expect from One Earth in Action initiative moving forward before we close the meeting finally. Right. So firstly, thank you very, very much. Really appreciate. We understand in the world today, things are moving very fast and people are busy trying to make things happen. And yeah, for you to take time and the resources, data, or whatever it took you to attend this, really appreciate it. We didn't take it for granted. And we hope that you have learned one or two things, you have one or two take-homes, assignments, and everything that will, help you get better when it comes to One Earth and entrepreneurship. Secondly, there is one tiny homework which is for everyone. Like I said, if you find any, I think AMR came up very strongly, but then if you find any laboratory solution that is promising, feel free to share it with us. I'll put my email in the chat box now, and we can work together with investors and other institutions and see how we can, bring them in, how we can make them work. On our own end, we can easily support like the education component of how to use these tools, and we can also support the marketing aspect, but then we can bring other partners that will have roles to play, and we can scale these kind of solutions in Africa. That is second. Number three, well, One Earth scenario part 6 will be coming up, but from this particular, we have a lot of inspiration from this particular episode. So the subsequent ones will be probably some, detailed workshop about a model solution for a One Health problem. Well, we might bring Dr. Shehu back to come and talk about animal health, last mile animal health service delivery. So, but it will be more of a workshop version, which will have step by step on one specific One Health problem. And now it is currently being solved using the One Health approach with entrepreneurship backset. All right. So thirdly, those that applied for the One Health implementation mentorship program, well, the call closed yesterday. We had 253 applications from all over Africa. Thank you very much. The good news is that we will not be making a call for cohort 2. We will use the same set of application to increase your chances of being selected. But as we speak, we're going to take 14 mentees, and some of them will be very fortunate because one of our mentors is offering to take his own mentees on field trips in Nigeria. So those that will be selected for Nigeria, congratulations. You have a lot of really interesting adventure with your mentor for the next 6 months, right? And lastly, the third edition of the African Youth Dialogue on One Health and Sustainable Livelihood is coming up early December. We're very sorry for the delay. It normally happens in November, but lots of logistics, and we're trying to create an entrepreneurial contest for this year's edition, and we were struggling to get something tangible for the reward, but we have found a solution, and we'll still be running the contest parallel to this year's African Youth Dialogue. So please watch out. We will be making announcements very soon as we get speakers to speak during the session. So that will be all from us, and until the 6th episode of the One Health Scenarios, I want to say a very big thank you once again. I can't thank you enough for taking time out. Myself, yeah, I understand how busy people can get these days, and yes, we deeply appreciate that. So we will make sure that the certificates come as soon as possible, but it will not come alone. It will come with a report, a briefing from this meeting, so that in case you missed anything, you can easily just grab to. Our reports are not usually very long, 1-2 pages, so that you can quickly read through and recall everything that happened in the meeting. And it will also come with a recording of the video in case you're interested in watching everything the way it happened. And yes, that said, thank you. I would like to make some special mentions. Dr. Abdurrahman Jibrin, he happens to be one of my lecturers, and then yeah, he's here. I really appreciate that. Dr. Francis, Dr. Kwajafa. Okay, Dr. Abdul, you want to say something?
No, actually, just go ahead. No, go ahead, please.
All right. If you can please then close the meeting while everybody turns on their camera for the screenshots. I'll do you the honor, sir.
Sorry, I'm sorry. My background is so is a bit poor. That's why I couldn't make any observation. But I'm very, glad to be part of this. And most of the discussion we had is a very, very fruitful discussion. I also sincerely appreciate what Dr. Shamsudeen have actually presented. The take-home message I have from this discussion is that how to interpret science into entrepreneurship. I mean, there's a lot of take-home messages from this discussion. Identifying a problem in the society, a public health challenge, a public health problem, and see how you can make money out of it. That's just the take-home message. From a public health challenge, and see how you can make money out of it. I think that's the main take-home message from this discussion. Sincerely appreciate that. Thank you very much.
Thank you so much, sir. And then I've taken some screenshots. Not many cameras came on, but I understand, yeah, it's getting towards evening in Nigeria. In Ethiopia, Kenya, Uganda, it's probably a bit dark, which means, all right. So yeah, more cameras are coming on so that we can take a bigger screenshot. All right. Thank you. Well, I can see beautiful faces. You can smile also so that it becomes a good one. Thank you. And colleagues from Ethiopia, thank you. I need to learn Swahili. We usually get a lot of participation from East Africa. And Jambo, Abari Yako, I can still speak a little bit of that. Thank you very much. All right. Screenshots taken. Thank you so much. And see you in the 6th episode of the Wonder Scenarios. Bye-bye, everyone.
Bye-bye.
Yeah, thank you, sir.
Bye bye, everyone.